and thanks for joining us. I'm Judy Simpson. Our focus this afternoon is on cancer in men. As part of our ongoing series with the Vermont Cancer Center of the University of Vermont and Fletcher Allen Healthcare, we want to raise awareness of the major cancer risks that men face and how those cancers can be prevented. Joining me is Dr. Mark Plant. Dr. Plant is chief of the urology division at Fletcher Allen, a cancer center member, and a professor in UVM's College of Medicine. You've been with us before, so welcome back. What's the key message that you want men to hear about their risk for cancer?
Well, firstly, thank you for having me. Really, the key message is that men need to become more aware that there are ways that cancer can be diagnosed more early, more curable thereafter. Cancer death is actually starting to become more of an issue because as heart disease-related deaths come down, cancer deaths are starting to come up. So it's very important that men talk to their doctor and look also at lifestyle issues that they can change. It's very, very important to eat healthy as well as remain active. Those tend to be the two most common things men can do to ensure a longer and more healthy life.
Is one of the problems that there's been so much emphasis on women in cancer, breast cancer especially?
Well, I have to say women have really paved the trail for men. Men tend not to be the greatest advocates, nor do they tend to be the greatest listeners. I suffer
No kidding.
Yeah, no kidding, and I suffer from the same. Suffice it to say, it really has allowed us to follow all the efforts that women have done for awareness and really try and raise our game.
And so what are the leading cancer dangers among men?
So at this time, the three most common cancers we're going to discuss in men are prostate cancer, lung cancer, as well as colon cancer. And right now, excluding skin cancer, lung cancer is second to prostate, and colon is a close third.
And prostate seems like it's pretty much far out in front.
Yeah, so prostate cancer numbers are much higher. The thing we have to remember, though, is lung cancer deaths actually surpass prostate cancer. So prostate cancer is more common, but not as common as a cause of death.
How effective are treatment techniques for these leading cancers?
So treatment techniques are effective, there's no question. For each of them, early diagnosis and treatment either by way of surgery, radiation, sometimes chemotherapy, can affect cure. So men can be cured of these cancers, but again, it's trying to find these cancers more early. And also, it's also important to make sure that we're being careful to only treat patients who need treatment.
What do you mean by that?
So as men and women, but as men for today's discussion are getting older, they have other conditions. So we have to be very sensitive that not every man needs to be treated for every cancer. If they have heart disease, if they have, God forbid, another cancer that predates the new diagnosis, we have to be mindful that you don't have to necessarily treat every condition. And part of medical care today is becoming more sensitive and more able to decide what needs treatment and when.
And so is that an easy message to send to the patient? I mean, that's kind of a hard one.
It's a very difficult message, but quite frankly, even our discussion today helps us start educating the public that don't always be afraid of a diagnosis. Sometimes it's a condition that's going to be best watched, and it includes many types of cancer. In my field, prostate cancer is not infrequently a cancer we're just going to watch. Kidney cancer sometimes is a condition we're going to watch. We're not necessarily going to go in with guns blazing just to treat at that moment.
And so I think that's an important message for people to realize too, is once you get that diagnosis, give yourself a little bit of time to sort of get over the shock, but then really start to think about what the options are.
Correct, and speak to your doctor. Make sure that they are putting it in perspective for you.
And so what are the screening options that are available to help prevent these cancers?
So if we look at prostate cancer, really the screening option that most people talk about is PSAs, which is a simple blood test, as well as rectal exam, which is physical examination. I can tell you there's a lot of controversy with regards to the use of these two. What I will say is if people look at the death rate from prostate cancer, it is one of the cancers that has shown the most robust decline in death rate over the last 25 years. So I think we have some work to do before we say something is useful or not.
So that would suggest to me then that these early screenings are very important.
I can tell you I think it is, and they are. But I would also say we overtreat some cancers, and prostate is probably one of them. So we need to be sensitive. if we're going to say a test is useful, we need to be doubly sure that we're not over-treating. Prostate cancer, just to put it in a nutshell, very, very important that men talk to their doctor about screening options. The thing I also want to underline, you know, we need to look at-risk populations. So if there's a family history of prostate cancer or African-American descent, that's where you need to be mindful that prostate cancer screening is probably even more important.
Well, let's talk about some of those changes. You said start talking to your doctor about the screening at age 50.
Yeah, so age-wise, if you think of prostate cancer, at-risk populations, typically we talk about screening at 40, some say 45. In general, for the general population of men, 50 has been the most accepted age range that we start talking about screening.
And so you also mentioned, too, if there's a family member who's had prostate cancer, that's important to know.
Absolutely, very, very important.
And so also, too, you talk about, we were talking earlier about self-exams for younger men?
Yeah, so although we don't have a slide speaking to it, testicle cancer is a very important disease that we shouldn't miss. And you know, for lack of better words, the beauty of it is for young males, typically 15 to 35 years of age, very important that they're examining their testicles in the shower monthly and really making sure there's no abnormal lumps or bumps. Testicle cancer is almost the poster child example of how you can render a cancer that used to be incurable to now curable. 99% of cancers are curable today with an admixture of surgery, radiation, and chemo.
Well, let's talk a little bit about lung cancer. Smoking still is the #1 cause?
Yeah, by far smoking, unfortunately, is the #1 cause of lung cancer, and thankfully a modifiable thing. Although not easy to quit smoking, it is the one thing that people can do. One of the things that the public does not understand, though, many cancer cases, unfortunately, are in non-smokers. And
yeah, that's very curious. And people are like, well, I've never smoked. How could I possibly have lung cancer?
And the difficulty is unfortunately, decades ago, they may have been exposed. So secondhand smoke, we all know, is very important. The problem is, how do you quantify it? It tends to be a decade later, and then it's really hard to say, well, how much secondhand smoke did I really have myself be exposed to?
Whether you had a spouse that smoked or a parent who smoked.
Correct.
Or a sibling.
Correct. And the thing with smoking, you know, and I hate to harp on it as the typical doctor about quitting smoking, but the thing with smoking, it is so critical that people around you, if they smoke and you're trying to quit, they really need to make the effort too, because it's an addiction like any other.
What about screening and prevention specific to colon cancer?
So colon cancer is another discussion piece with the family doctor, but again, thankfully we have a screening technique, although not as easy as a blood test. Colonoscopy has been shown to be effective in terms of diagnosing both men and women with colon cancer earlier. And again, earlier detection allows for earlier treatments that tend to be more likely to cure.
And your doctor, too, will tell you after your first colonoscopy how soon you have to come back for another one. Correct.
So as we get smarter, we're more and better able to know how often do we really need to do these tests. And in colonoscopy screening or colon cancer realms, we now see that if you have a normal colonoscopy with no risk factors, you may only need it every 10 years.
And so one of the problems with this particular technique is the high sort of ick factor. You know, people don't like to talk about it. You know, prepping for this treatment is not pleasant. How do you get over that as a physician to urge people or to tell our viewers how important these kinds of things are?
So I need to preface my comment. As a urologist, I'm spared the how might we say, making patients more comfortable regarding colonoscopy. But I will say it's our responsibility as docs to make sure that people understand we don't want to have to do this either. And for myself as a urologist, I don't like having patients undergo a blood test or even a finger wave, as I call it, for the physical examination, and in colonoscopy even less. The truth is we always have to remind patients and ourselves of the back-end benefit. If we diagnose someone with an aggressive polyp in their colon, and that's all they have, we have an opportunity to give them a more simple treatment to keep that polyp from becoming a bigger tumor that then could obstruct their colon, can spread to other parts of their body, and ultimately kill them.
Now, you talked about your responsibility as a physician, but don't we also, as people, have responsibilities to take the lead on our own health care?
We do. We do. We need to always focus on the fact that, and the message actually is not that complicated. It's healthy eating and staying active. Mm-hmm. We do have a responsibility to ourselves and our loved ones. But I would love to say that I'm perfect. I'm certainly not. So living in a glass house, I can tell everybody I can be better, and I think we all can.
Well, if you're just joining us, we're discussing the top cancer risks in men with Dr. Mark Plant. How are these cancers typically treated? Is surgery usually an option?
So going through the three of them, prostate cancer, so again, a lot of men may not need it treated, so active surveillance is what we would do, keeping an eye on it. But surgery and radiation tend to be the mainstay treatments in terms of, how would you cure a man of prostate cancer. In terms of lung cancer, now we have newer techniques where you don't necessarily have to operate on the lung. You can actually treat the tumor just where it is within the lung, but surgery remains the mainstay for curatability of that cancer. Mm-hmm. In terms of colon again, it's colonoscopy. If it's a very small polyp, it can be treated at the time of colonoscopy, but surgery again is typically the treatment that you're going to offer people to cure it.
Now, the Cancer Center is doing a lot to raise awareness of men's cancer, and you're having some fun doing that as well. Can you tell us about that?
Yeah, so for men's health awareness, there's a national movement called Movember. Mm-hmm. So what we're doing locally, because we have some efforts going on with regards to cancer research, and we'd like to raise some funds in support of them, we're going to have Brovember. So it's the idea of getting a bro to grow a mo in support of men's health awareness.
And so here's a picture that we're looking at. Who are these folks?
So these are chairs of departments. We have the dean of the medical school. We have myself and others who participated. Really the goal this year is to have less fake mustaches on this picture and more real ones. I was one of the real ones. And not to say that it's universally accepted that I'm walking around with a mustache by my friends and family, but I'll be doing it again this year. And really it's about upping our game again to get people thinking about men's health and awareness.
And you're inviting the public to participate in Brovember?
Yeah, so we certainly are, and I look forward to seeing more mo's from bros around the community. One of the things we're also looking to do is to have, we're going to have an evening. Lunix has graciously allowed for us to have some support developed on the 16th of November. There's going to be an evening whereby funds are going to be raised from people attending Lunix event. So many thanks to Lunix. I also need to take a moment and thank WCAX, because you have always been a mainstay in helping us raise awareness. And again, the funds raised would support local research. We have some very dedicated researchers at the university who have really put forth a Herculean effort to get us looking at new ways and earlier ways to diagnose important cancers.
Now, as the Cancer Center looks ahead, what awareness and education initiatives are you putting together for 2015?
So for 2015, we actually will have a men's health as well as cancer conference in June 26th, 2015. So that's going to be a full-day conference that we're putting together. Several faculty are going to be leading it. We've had one in the past, but this one is going to be bigger and better.
Mm-hmm. Let's just talk a little bit for maybe folks who didn't see the beginning of the program. The leading cancer dangers among men are what again? So
the leading cancer, so again, I have to speak to skin is a #1 diagnosed cancer in men, so it's an important one. But prostate, lung, colon, and in younger males, testicle cancer is also important.
Mm-hmm. And once again, the Cancer Center is looking ahead, the awareness and education initiatives, a men's health and cancer conference on June 26th, 2015. Why should men participate in that?
I think it's their opportunity, again, as I spoke to before, for us to raise our game. The more people that are aware of health issues, the more actually we can then engage the community in learning more and being better about our approach to remaining healthy and raising the overall health of our community.
And talk about it as well.
There's no question we need to be talking about it.
Well, thanks, Mark, for joining us today.
Thank you so much.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.